Caritas is an integrated health service that provides holistic care for persons with dementia. It primarily serves residents in the northern region of Singapore. Our population in Singapore is aging rapidly today. In 2015, we had 440,000 seniors. Among these, 10% are frail with multiple problems. Apart from chronic medical conditions such as diabetes, they also suffer from geriatric syndromes such as falls and dementia. Take a look at John, an 80-year-old man with moderate stage dementia. He also has high blood pressure, diabetes, arthritis, and poor vision. His daughter is stressed, caring for him, and coping with her job. There are multiple gaps in the healthcare system today. Care is centered around the hospital system. Care providers in the community lack support, and there is a lack of integration and coordination of services. Why is care hospital-centric? Remember John, who has moderate stage of dementia, hypertension, diabetes, arthritis, and poor vision? If he visits a hospital, he must go to different clinics on different days to see different healthcare professionals. This is different from care that is centered around the patient. In patient-centric care, John will be able to see different healthcare professionals at the same place on the same day. Care providers in the community may lack support. For example, the case manager or community social worker may not have easy access to a doctor to discuss complex medical issues of patients under their care. There is also a lack of integration and coordination of services. Hence, when John is admitted to hospital, his new team of doctors and therapists may be unaware of previous management efforts. As a result, John's daughter is frustrated and anxious. So how can we care better for John? We are introducing Caritas iCommunity at North. As seniors transit from wellness to sickness, Caritas provides holistic, integrated, and person-centered care. Caritas adopts the philosophy of person-centered care that aspires to provide care that is personalized, coordinated, and enabling. It respects and upholds the dignity of the person. What does Caritas stand for? C means comprehensive. Comprehensive care unites the physical, psychological, and social aspects of the person. Comprehensive care integrates the medical needs of the person with his social needs. Ever accessible and responsive to the needs of the patient. Wherever and whenever needed, there is a helpline through which patients can access us. A real-time IT system supported by a patient database enables such care. Care is individualized as every patient is unique. Care that is delivered through a personalized patient care manager who fosters an enduring relationship with the patient ensures that person-centeredness is upheld. Transdisciplinary means that the team comprises multidisciplinary members. As they incorporate skills from each other's disciplines, everyone now becomes a new elder care specialist. A stands for accountable. The team meets regularly to discuss what is best for the patient according to evidence-based standards of care. Finally, seamless care that transcends care settings is enabled by a vertically integrated team comprising members from the tertiary hospital, primary care, daycare, and home care. Members are now brought together to form a cohesive VIT that cares for the patient across the wellness and illness continuum and across care settings with long-term ownership. Let's look at how Caritas can be used to care for a patient with dementia in the Northern Regional Health System. KTPH and YCH provide tertiary care, Yishun Polyclinic provides primary care, and Clarity and Ojoy provide home-based counselling. Tai Hwa Kwan and NTUC elder sitters bring companionship and engagement to the elderly. Tai Hwa Kwan Crest provides case management. Finally, daycare and spice centres in Sri Narayana, Swami and St. Luke's Eldercare complete the holistic picture. Caritas can be considered an integrated practice unit across care settings. It pools resources and organizes them around the patient to provide holistic care. Let's look at John again, this time with Caritas Care. John is visited regularly by his case manager, a trained social worker who not only coordinates his care but also sorts out his medications and provides emotional support to him and his daughter. She helps John enroll into a daycare center. The daycare staff monitor his medical condition, blood pressure, body weight and oral intake. John is now happier, and physiotherapy has helped improve his function. One day, John was noted to pass blood in his stools. Instead of bringing him to the emergency department, his daughter called the Caritas helpline. John was then reviewed that day in the Caritas early review clinic and found to have bleeding piles. The treatment involved daily application of a cream to the piles. The staff in the daycare assisted in the treatment and taught his daughter how to care for her father. The daycare manager and social worker attend weekly Caritas team meetings where they provide updates on John's condition. The team can then decide on how better to care for John and his daughter. In 2 weeks, the piles shrunk and John had no more bleeding. Today, most care is not integrated but a collection of fragmented services. Caritas is a model of integrated care whereby we work together to provide holistic care for our patients. Let's make Caritas the model of person-centered integrated care today.